So, hello everyone, we are the group 3 and our topics is all about compare metabolic acidosis and alkalosis with regard to the cause, clinical manifestation, diagnosis, and management. And also compare the respiratory acidosis and alkalosis with regard to cause, clinical manifestation, and also diagnosis and management. And the last one is interpret arterial blood gas measurement. Compare metabolic acidosis and alkalosis. So I'm going to tackle the metabolic acidosis and Ms. Nurhaliza Waras going to tackle about the alkalosis. So first is metabolic acidosis is a common clinical disturbance characterized by a low pH, increased H plus concentration, and a low plasma bicarbonate concentration. It can be produced or by a gain of hydrogen ion or loss by carbonate. So, saan ba tayo nakakakuha ng metabolic acidosis? Bakit nagkakaroon po tayo? In short, nakakakuha po tayo nito kapag mataas po yung acids sa body fluids ng isang tao. Kaya nagkakaroon ng metabolic acidosis. So, ano po ba ito yung H plus concentration? Ito po yung hydrogen ion concentration. Ito yung kumbaga nagme-measure sa acidity sa ating katawan. So ano naman yung plasma bicarbonate concentration? Ito naman po yung too much acids na sa katawan natin na yun yung magli-leads sa na nagkakaroon yung tao ng metabolic acidosis. So, meron po tayong most common cause ng metabolic acidosis. So, ito yung kapag nag-occur siya yung sa body natin na nagproduce po siya ng maraming acid. And kapag yung kidney natin, hindi din po siya nagre-remove ng enough acid sa ating katawan. So, yun po yung mag-lead sa metabolic acidosis. So, next is most common po yung acidosis, yung metabolic acidosis sa hyperchloremic metabolic acidosis or the gastrointestinal bicarbonate loss. So, clinical manifestation, signs and symptoms of metabolic acidosis vary with the severity of the acidosis but include headache, confusion, drowsiness, increased respiratory rate and depth, nausea, and vomiting. So, ito yung clinical manifestation ng metabolic acidosis. Kapag yung tao ay nakakaramdam ng sintomas na sumasakit yung ulo, nagkakaroon ng confusion, and also kapag madalas yung antukin, so nagkakaroon ng drowsiness, and tumataas din also yung respiratory niya, yung rate pati depth. And also kapag yung tao nakakaramdam din ng masusuka or nagsusuka na yung isang tao, so yun na yung sign na meron kang metabolic acidosis na kailangan agapan agad. So, next is the assessment and diagnostic. So, finding arterial blood gas measurement are valuable diagnosing metabolic acidosis. So, hyperkalemia may accompany metabolic acidosis, a result of the shift of potassium out of the cells later as the acidosis is corrected. Potassium moves back into the cells of hyperkalemia may occur. So, hyperventilation decrease the CO2 level as the compensatory action. So, ito naman na kapag yung assessment and diagnose na meron kang metabolic acidosis. So, yung nagkakaroon ng hyperkalemia. So, kumbaga, sumasama yung hyperkalemia sa metabolic acidosis na it will leads or nag-result siya ng mag-shift ng potassium sa body natin. So, later, kapag yung acidosis naman is na corrected na siya, yung potassium is nagbaback siya sa cells, nagbaback into the cells na siya. So, nag-occur na yon. So, next is the medical management. So, treatment is directed at correcting metabolic imbalance. If the problem results from excessive intake of chloride, treatment is aimed to eliminating the source of the chloride. When necessary, bicarbonate is given. However, the administration of sodium bicarbonate during cardiac arrest can result in paradoxal intracellular acidosis. So, ito yung medical management na kapag meron ang isang tao na metabolic acidosis, yung treatment niya po, ito yung kinokorek ang metabolic imbalance niya. Halimbawa, madami yung na-excess niya chloride. So, yung treatment dito is kung i-eliminate yun siya, yung source ng chloride sa isang tao. So, hindi siya pwedeng mag-excess na kumain or marami yung napapasama na yung chloride. So, kailangan i-eliminate yun siya. So, titingnan yung i-correct yung imbalance ng metabolic niya. So yung treatment for metabolic acidosis also works in 3 ways. So, ito yung 3 ways na yung parang matitreat yung metabolic acidosis kung meron yung isang tao. So, first is we need to excreting or getting rid of excess acids. So, buffering acids with a base to imbalance blood acidity and preventing the body from making too many acids. So, ito yung mga kumbaga na dapat sundin. 3 ways na to. Kailangan ay getting rid lang yung pag-excess ng acids. So, tapos kailangan din na yung acidity sa blood ng isang tao. So, piniprevent din siya na piniprevent din po siya kapag marami na yung natitake na acid. So, kailangan siya. Yung tulad ng sinabi ko na yung metabolic imbalance, kailangan natin i-treat, dagdagan or bawasan rather yung pag-excess ng isang maraming nagkukos ng acid sa katawan natin. So, that's all.
This can be attributed to the excess vomiting, which causes electrolyte loss. Overuse of diuretic can cause hypokalemia, which may precipitate to cardiac arrhythmia. Large loss of potassium or sodium in a short amount of time. A slight decrease of potassium can cause no symptoms. A large decrease can cause muscle weakness, cramping, twitches, and even paralysis. Antacid, accidental ingestion of bicarbonate, which can be found in baking soda. Accidental ingestion of bicarbonate can cause metabolic alkalosis. Laxative can lead to electrolyte disturbances, dehydrations, and mineral deficiencies, and also alcohol abuse. Clinical manifestation. Alkalosis is primarily manifested by the symptoms related to decrease of calcium ionization, such as tingling of fingers and toes, dizziness, and hypertonic muscle. Assessment and diagnostic findings. The first thing to do is to physical examine the patient to evaluate the symptoms, and also blood testing to measure the blood gases, acid-base balance, and also the electrolyte fluids. And also electrocardiogram or the EKG to check for the presence of arrhythmia. And also urinalysis. Urinalysis may help to find the cause of metabolic alkalosis. Management and treatment of metabolic alkalosis depends on underlying cause, whether your alkalosis is chloride responsive or chloride resistant. For chloride responsive, it is a result from loss of hydrogen ions, usually by vomiting or dehydration. In this, you may have to make an adjustment in your diet, such as increasing your intake of sodium chloride. But if you need an immediate attention, they may give you an intravenous drip in that contains saline solution, the sodium chloride. For chloride-resistant alkalosis, this is a result when your body retains too many bicarbonate alkaline ions, or when there's a ship of hydrogen ions from your blood to your cells. In chloride-resistant alkalosis, your body may be depleted of potassium, as sodium chloride won't help you and can make things worse. Instead, look for ways to increase your potassium, such as taking pills containing potassium chloride and receiving potassium chloride through or via IV or intravenous drip.
So, yung topic ko is yung respiratory alkalosis. So, the respiratory alkalosis is alkalosis occurs when you breathe too fast or too deep and carbon dioxide level drop too low. So, this causes the pH of the blood to rise and become too alkaline. So when we say respiratory alkalosis occurs when the levels of carbon dioxide and oxygens in the blood are not balanced. So your body needs oxygen to function properly. Then when you inhale, you introduce oxygen into the lungs. Then when you exhale, you release the carbon dioxide, so which is a waste product. So normally the respiratory system keeps these two gases in balance. So respiratory alkalosis is occurs when you breathe too fast or too deep and the carbon dioxide levels drop too low. So next is the causes and hyperventilations of the respiratory alkalosis are the anxiety or panic, fever, overbreathing, pregnancy. So, yung pregnancy is normal siya. Pain, tumor, trauma, severe anemia, liver disease, and the last is the overdose of certain medicines such as salicylates, progesterone. So, yung respiratory alkalosis is hyperreflexes and muscle cramping, which is yung mga seizures, anxiety, irritability. So, yung causes niya is hyperventilation. Yung hyperventilation is tumataas siya and also bumababa din. So, tachycardia or the normal BP, hypokalemia. So, the respiratory alkalosis diagnosis and management. So, yung diagnosis ng alkalosis is a doctor can diagnose respiratory alkalosis using a blood test na tinatawag na arterial blood gas test. So, they will take blood from an artery and a special machine will then interpret the acid alkaline content of the blood. So the next is, how can respiratory alkalosis be prevented? So prevention is a matter of addressing the cause of the hyperventilation. So the most common causes of are the psychological. So yung mga most common prevention ng respiratory alkalosis is yung mga stress, panic, anxiety. So you can adjust to and learn to control these causes. So working with therapies may help. So can breathing exercise, medication, and regular exercises. So medication may be needed in some cases. So, and also, tumutulong din yung good coping strategies for these types of issues are crucial. So, they can help lower the risk of the hyperventilation and the resulting of the respiratory alkalosis. So, they can also help you to function better overall in everyday life. So, that's all.
Hello everyone, my topic is about compare respiratory acidosis and alkalosis with regard to causes, clinical manifestation, diagnosis, and management. Respiratory acidosis is decrease in respiratory rate or volume Those that affect in pH due to change in concentration are called respiratory acidosis. So when we say respiratory acidosis is a condition that occurs when the lungs can't remove enough of the carbon dioxide produced by the body. Excess carbon dioxide causes the pH of blood and other body fluids to decrease, them to do the acidic. Normally, the body is able to balance the iron that control acidity. This balance is measured on a pH scale from 0 to 14. Acidosis occurs when the pH of the blood falls below between 7.35 to 7.45. And also there are acute respiratory acidosis and chronic respiratory acidosis. So when we say acute respiratory acidosis occurs quickly, it is a medical emergency. So when we say also chronic respiratory acidosis develops over the time, it doesn't cause symptoms. Instead, the body adapts to the increased acidity. There are common causes of respiratory acidosis. There are asthma, chronic obstructive pulmonary disease or COPD, acute pulmonary edema, severe obesity, and neuromuscular disorders and scoliosis. And there are symptoms of respiratory acidosis. There are the symptoms between central, muscular, respiratory, heart, gastric, and intestinal. Central, the headache, sleepiness, confusion, loss of consciousness, and coma. And for the muscular, seizure and weakness. For the intestinal, diarrhea. And for the respiratory, there are shortness of breath and coughing. And for the heart, arrhythmia, increased heart rate. And for the gastric, there are nausea and vomiting. So for respiratory diagnosis and management, the most important test for the diagnosis of respiratory acidosis is the arterial blood gas measurement, and the oxygen is if the blood oxygen is low. Respiratory acidosis intervention, we have maintain patient airway, exchange gas exchange, and pulmonary hygiene, poison breathing techniques, and ventilator support, prevention of complication, drug therapy aimed at increase diameter of airway and the secretion. And for the respiratory acidosis treatment, we have restor ventilation, IV lactate solution, the bicarb IV, and treat underlying dysfunction or disease. So that's all for the respiratory acidosis.
Objective learning number 9. Interpret arterial blood gases measurement. So, assessing the 4 arterial blood gases, the following steps are the recommended to evaluate blood gas values. So, they are the based on the assumption that the average values are potential of hydrogen 7.4 and partial pressure are of carbon dioxide 40 millimeter mercury. So the last is bicarbonate 24. So the next is the first note the potential of hydrogen. It can be high, low, or normal as follows. So a normal potential of hydrogen is may indicated perfectly normal blood gases, or it's may indicated a compensate imbalance. So a compensate imbalance is one in which the body has been able to the potential hydrogen by either respiratory or metabolic changes. For examples is a patient with a primary metabolic acidosis start off with a low bicarbonate level, but but a normal carbon dioxide is a level. Soon afterward, the lungs try to compensate and for the imbalance by exhaling large amount. So, for another example is a patient is a is a patient with the primary respiratory acidosis start out with the high carbon dioxide level. Soon the afterward, the kidneys attempt compensate the by um, retaining bicarbonate. If the compensatory um, me- mechanism is able to restore the carbonate to carbonic acid and ratio back to 20.1 and full compensation, and thus the normal potential of hypertension. So potential of hydrogen less than 7.4 alkalosis and potential of hydrogen greater than 7.4 acidosis, and potential of hydrogen 7.4 is normal. So when you say the alkalosis is occurs when your blood and body fluids contain or alkali balance critical to your well-being. When the balance is of even by small amount, it can make sick. So acidosis is a condition in which there is too much acid in the fluids. It is the opposite the alkalosis. So that a cause of acidosis by an overproduction of able rather, and that builds up in the blood, or an excessive loss of the bicarbonate from the blood. So the next step is it is a determine the primary cause of the disturbance. This done by evaluating the partial pressures of the carbon dioxide and bicarbonate in relation to the potential of hydrogen. For example, potential of hydrogen greater than 7.4 acidosis. If the partial pressure of carbon dioxide is greater than greater than the 40 millimeter mercury. If the primary is disturbance is metabolic alkalosis is respiratory acidosis. So this situation occurs when the patient hyperventilates and thus retains too much carbon dioxide and acidic substance. That is letter A rather. So for the letter B is if the bicarbonate is less than 24, the primary disturbance is metabolic acidosis. So this situation occur when the patient when the body rather bicarbonate level drops, either becomes to bicarbonate loss, or because of gains of acids such as lactic or ketones. So the next step involve the determining if the compensation has begun. This is done by looking at the values other than primary disorder if it is the moving in the same direction as the primary value compensation is underway. Consider the following. So first set is indicate acute respiratory acidosis without compensation. So the particle pressure of the carbon dioxide, the carbon dioxide is normal. So the second set is indicates rather chronic respiratory acidosis. Note that the compensation has taken place, that is the bicarbonate has elevated to an appropriate level to the balance the high partial pressure of carbon dioxide and produce a normal potential of hydrogen. So potential of hydrogen is 7.2. The partial pressure of carbon dioxide is 60 millimeter mercury, and the bicarbonate is 24, and then potential of hydrogen hydrogen 7.4, and partial pressure of carbon dioxide is 60 millimeter mercury, and bicarbonate is 37. Potential of hydrogen 7.30, partial pressure of carbon dioxide 55 millimeter mercury, and bicarbonated is 25. The next is potential of hydrogen 7.49, and partial pressure of carbon dioxide is 44 millimeter mercury, and the bicarbonate is 29.
So, my report is assessing blood gases. So, this is the continuation report of Aling, Tab, Bantonio. So, persist two distinct acid-base disturbances may occur simultaneously. This can be identified when the pH does not explain one of the changes, when the PaCO2 is increased, or also known as the partial pressure of carbon dioxide, and the HCO3 decreasing, or also known as the bicarbonate, is a product of our body's metabolism. Respiratory acidosis and metabolic acidosis coexist when the PaCO2 is decreased, or the partial pressure of carbon dioxide, and the HCO3 is increasing, or also known as the bicarbonate, and the respiratory alkalosis and metabolic alkalosis coexist. So the example of metabolic respiratory acidosis, so pH is the 7.2 and acid decrease. Then B, PaCO2, or the partial pressure of carbon dioxide 52, and the acid decrease. Then CH, then the CH is the and the CHCO3, or the bicarbonate 13, the acid is decreased. pH imbalance nagdi-lead into two conditions. Ito yung acidosis and alkalosis. So yung acidosis, ito yung refer to having the blood that too acidic, blood pH less than the 7.35. Then yung alkalosis, it nagre-refer to sa having the bloods that too basic, or blood pH of higher than 7.45. So common cause nito is the use of diuretics and the external loss of gastric secretion. Next one is the if metabolic acidosis exists, then calculate the anion gap, or the AG, to determine the cause of the metabolic acidosis. So the AG and the non-AG. So the non-gap metabolic acidosis, or hyperchloremic metabolic acidosis, are a group of disorders and characterized by a low bicarbonate and hyperchloremia and normal anion gap. Then the anion gap is a measurement of the anion gap, or the AG is a measurement of the difference or gap between the negatively charged and possibly charged electrolytes. And if the anion gap is either too high or too low, it may be a sign of disorder in your lungs, kidneys, or other organ system. The next one is evaluate the patient to determine if the clinical sign and symptoms are compatible with the acid-base analysis. So, evaluate the patient. Ito yung a nurse or doctor, chine-check or ini-examine nila yung isang patient kung mayroon bang improvement sa kanilang physical or mental condition. So, that's all. Thank you.